One of the common fears that I hear from my patients who are pregnant or considering pregnancy, as well as friends and family member, is that they're petrified of having a laceration at the time of vaginal delivery. Now, yes, laboring can be unpredictable, and there's no way to know what kind of a laceration somebody will have, but it doesn't have to be scary or unknown. So in today's video, we're going to learn about the external female genitalia and what can happen if somebody has a tear during process of labor. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, welcome. And if you like what you see, don't forget to subscribe and share it with a friend. Now, over the last few weeks, I've been doing videos talking about the female anatomy. We've talked about the internal female organs and what are the functions of each of the organs. We've also looked at anatomy as it relates to pelvic organ prolapse. So in today's video, we're going to be focusing on the external genitalia. So I have my handy pelvic model right here. So we'll look at the anatomy from this model, and then I'll also do a schematic, and I'll also do a schematic description at the end, looking at the different kinds of lacerations that women can have during laboring. So let's break down the external female genitalia, which is also known as the vulva. And the vulva has multiple different parts, so we're going to start from the top. So this little yellow dot right here is the clitoris. Right underneath that, you have this black dot, which is the urethra, which is the opening through which urine comes out. So the urethra is also known as the pee pipe. It's connected to the bladder, which is the organ that holds our urine. Underneath the urethra, you have the vaginal opening right here. And of course, during pregnancy or during laboring, we have the baby being born through the vagina if you're having a vaginal birth. And of course, during intercourse, you have penetration through the vaginal opening. And underneath that is the anal opening, which is where stool comes out. So again, in summary, there are three main openings. So you have the urethral opening through which urine comes out. You have the vaginal opening through which a baby comes out. And then the anal opening through which stool comes out. Now, the hymen is inside the vaginal opening. So if you have a female who has never been sexually active, their hymen is going to be intact right here. Now, right around these openings, you see this pink fold. This is known as the labia minora. And around it, it's not shown here in this pelvic model, but you have that thicker skin fold, which is known as the labia majora. So the labia majora and the labia minora together is basically protecting the urethral opening and the vaginal opening. Now, the thing I always tell patients is that the external genitalia can look very different in different patients. Because oftentimes I'll have patients come to me, especially after they've had a vaginal birth, because they're concerned with the external look of their labia minora or labia majora. That's a whole other discussion for a different day, but understand that there are lots of factors that can affect how somebody's external genitalia looks. And there's a lot of variability based on your ethnicity, based on your race, based on your age. There's no right or wrong way for the external genitalia to look. If you're interested in this topic, put it in the comments below and I'll be happy to do a whole other video on that. Now, one thing to mention is the clitoris, which sits right on top of the vulva. It has a lot of nerve endings and vascularity, which makes it a very important structure as it relates to sexual pleasure. And for a lot of women, clitoral stimulation can be really important for sexual pleasure and intimacy. Now, other structures of importance here, as you can see, these muscles right here that's crisscrossing between the vaginal opening and the anal opening are some of the perineal muscles that we'll talk about in a little bit, because these are some muscles that can tear during a vaginal laceration. And then these big muscles right here, which essentially forms the floor of the pelvis, are part of the pelvic floor muscles that's helping support all the pelvic organs that's sitting right in that pelvis. Now, just to give you a 3D orientation, you have the bony pelvis, which is the white part right here. The pelvic floor muscles essentially form the floor, and it's supporting all the pelvic organs, which, as you can see, is the uterus, the bladder. There's also rectum behind, and then of course small intestines, which is not shown here. All those are being supported by the pelvic floor muscles, which essentially forms the base of our torso or the base of our pelvis. So now let's change the view a little bit. We're looking at a schematic that again shows the external genitalia right here, but we're going to look at what happens during vaginal delivery when you have a vaginal laceration. For orientation, this is the external genitalia. As you can see, these are the patient's legs kind of coming out. This is the vulva right here as we looked at the pelvic model. So again, reviewing, the top of the vulva is where we have the clitoris. Right next to it is the urethral opening. Underneath that, you have the vaginal opening. And then underneath that, we have the anal opening. You have the labia minora, which is that thin skin fold around the urethral opening and the vaginal opening. And next to that is the thicker skin fold, which is the labia majora. This whole external genitalia altogether is known as the vulva. When somebody has a vaginal tear during labor, this is probably the most common place they have a tear. So as you can see, this is the vaginal opening. This is what we call the posterior vaginal wall because it's the back side of the vagina. This is known as the anterior vaginal wall, which is next to the urethral opening, and the bladder is somewhere up here. But as you can see, when there's a tear, it can be very superficial, where it's limited to just the vaginal epithelium and the skin in this area, or it can be a deep laceration where the tear actually extends all the way up to the anal opening. So when we're describing a vaginal laceration, we're actually describing it as a first-degree laceration, second-degree laceration, third-degree, and fourth-degree laceration. And each of them have a very specific definition. The first-degree laceration is the least severe form, which essentially means you just have a very superficial tear, which could be just the vaginal epithelium, meaning the top layer of the vagina right here, and maybe a little bit of the skin of the outside vulva that tore. But the muscles and the tissue underneath are all intact. So that's a first-degree laceration. A second-degree laceration is a little bit deeper, which extends into the fascia as well as the musculature of the perineal body, which is these muscles right here. Third-degree laceration is when the tear extends through the vaginal epithelium, through the musculature underneath, and it's actually extending into the anal sphincter muscles. Remember, this is the anal opening. So around the anal opening, we have the anal sphincter muscle. So that's the muscle that lets us control our stool. So it's very important for normal bowel function. So when you have a tear in the anal sphincter muscles, that's when women can complain of not being able to control stool. So a third-degree tear is when this vaginal laceration extends into those anal sphincter muscles. There's different categories of third-degree lacerations. I'm not going to go into too much details on that, but know that a third-degree laceration means that there was injury to the anal sphincter muscles, and so patients may see that they have some difficulties afterwards with bowel movement if this was not repaired right. And finally, a fourth-degree laceration is when you have a vaginal tear that extends all the way from the vaginal opening all the way to the anal opening. So you have a tear through the vaginal epithelium, the perineal muscles, the anal sphincter muscles. So it's basically one big opening. Again, like I mentioned before, that unfortunately there's no way to predict what kind of laceration a patient will have at the time of vaginal delivery. Also understand that having a laceration is not the end of the world. What is important is that it gets repaired properly. So as you can imagine, a fourth-degree laceration repair will involve a lot more details because you have to close not only the rectal mucosa, you have to close the anal sphincter muscles, you have to close the perineal muscles, and then come all the way up to the vaginal opening. So there's a lot that goes in, and of course you want to make sure that this was done by a physician who have a lot of experience taking care of patients with these kind of tears. Hope you found that video helpful and you learned a lot about the female external genitalia as well as the different kinds of laceration and what that means anatomically. Now, the purpose of this video again is not to scare patients about vaginal delivery or tears. The idea is to get you familiar with the terminologies, get you familiar with what can potentially happen. The thing that I always tell my patients is that our bodies are amazing. They heal very, very well. And even for patients who have third-degree or fourth-degree lacerations, if repaired well and treated appropriately, patients do very, very well. But having said that, if you're somebody who has had a bad tear during one of your vaginal deliveries and are suffering with some of the long-standing side effects as a result of a repair that was not done correctly, don't suffer in silence. Make sure you see a specialist, preferably a urogynecologist who has experience taking care of patients just like you, because a lot of these can be reversed even if you're remote from your vaginal delivery. If you haven't already, don't forget to subscribe and also check out some of my older videos where I talk about the female anatomy from different perspectives. I think you'll find it very valuable. And I'll be back next week with some more exciting videos. Talk to you soon. Bye.